Heart morphogenesis. First functional organ in vertebrate embryos, which beat spontaneously by week 4 of development. Cardiac looping is the primary heart tube loops to establish left-right polarity, which begins in week 4 of development. The defect in the left-right dynein, which is involved in the left-right asymmetry, can lead to dextrocardia, as seen in cartilaginous syndrome. Next, septation of the chambers. First is the atria. So, the septum primum grows towards the endocardial cushions, narrowing the ostium primum. Ostium secundum forms in septum primum due to cell death. So, as the ostium primum regresses, the ostium secundum develops on the right side of the septum primum, as the ostium secundum maintains the right to left shunt. Then the septum secundum expands and covers most of the ostium secundum. So the residual foramen is called the foramen ovale. So the foramen ovale is the residual foramen of the ostium secundum. Next, the remaining portion of the septum primum forms one-way valve of the foramen ovale. Septum primum closes against septum secundum, sealing the foramen ovale soon after birth because of the increased in the left atrial pressure and decreased in the right atrial pressure. Septum secundum and septum primum fuse during infancy or early childhood, forming the atrial septum. What is patent foramen ovale? It is the failure of the septum primum and septum secundum to fuse after birth, which is seen in 25% of the population. Most are asymptomatic and remain undetected. It can lead to paradoxical emboli, that is venous thromboemboli, entering the systemic arterial circulation through right to left shunt, as can occur in the ASD or the atrial septal defects. Next, ventricles. Muscular interventricular septum forms. The opening is called the interventricular foramen. Aorticopulmonary septum rotates and fuses with the muscular ventricular septum to form the membranous interventricular septum, closing the interventricular foramen. Growth of the endocardial cushion separates the atria from the ventricles and contributes to both atrial septation and membranous portion of the interventricular septum. VSD or the ventricular septal defect is the most common congenital cardiac anomaly. Usually it occurs in the membranous septum. So this is the membranous septum. Outflow tract formation. The neural crest cell migrations. Then there is truncal and bulbar ridges that spiral and fuse to form the aorticopulmonary septum, which forms the ascending aorta and the pulmonary trunk. So conotruncal abnormalities associated with the failure of the neural crest cells to migrate can cause transposition of great arteries, tetralogy of Fallot, and persistent truncus arteriosus. Next is valve development, that is aortic and pulmonary valves are derived from the endocardial cushions of the outflow tract. Mitral and the tricuspid valves are derived from the fused endocardial cushion of the AV canal. So valvular anomalies may be stenotic, regurgitant, atretic, like tricuspid atresia, or displaced like Epstein's anomaly. Heart embryology. Embryonic structure is, we will see which is embryonic structure and what it gives rise to. So the right common cardinal vein and the right anterior cardinal vein gives rise to the superior vena cava. So this is the right common cardinal vein and the right anterior cardinal vein. Next, the posterior cardinal, subcardinal and supracardinal veins give rise to the inferior vena cava. Then right horn of sinus venosus gives rise to the smooth part of the right atrium. Left horn of sinus venosus gives the rise to the coronary sinus. Primitive pulmonary vein gives rise to the smooth part of the left atrium. Primitive atrium gives rise to the trabeculated part of the left and the right atria. Endocardial cushion gives rise to the atrial septum, membranous interventricular septum, AV and the semilunar valves. Then the primitive ventricle gives rise to the trabeculated part of the right and left ventricles. Bulbous cordis gives the smooth parts of the left and the right ventricles. Truncus arteriosus gives the ascending aorta and the pulmonary trunk. So this whole portion rotates and then this goes up. So this how this part gives rise to the ventricle. Next, looking at the fetal circulation, blood in the umbilical vein has a PO2 of approximately 30 millimeters of mercury and is 80% saturated with oxygen. Umbilical arteries have low oxygen saturation. So there are three important shunts. One is blood entering the fetus through the umbilical vein is conducted via the ductus venosus into the IVC, bypassing the hepatic circulation. So most of the highly oxygenated blood reaching the heart via the IVC is directed through foramen ovale into the left atrium. This is the foramen ovale into the left atrium. So deoxygenated blood from the SVC passes through the right atrium, then to the right ventricle, to the main pulmonary artery, ductus arteriosus, and then descending aorta. So the shunt is due to the high fetal pulmonary artery resistance. At birth, infant takes a breath. There is a fall in the resistance in the pulmonary vasculature, which increases the left atrial pressure versus the right atrial pressure. The foramen ovale closes, now called as the fossa ovalis. Increase in the oxygen from respiration and decrease in the prostaglandins due to the separation of placenta, which all leads to the closure of ductus arteriosus. NSAIDs like indomethacin, ibuprofen or acetaminophen help the closing of the patent ductus arteriosus, which is called as the ligamentum arteriosum, that is the remnant of the ductus arteriosus. Endomethacin ends the PDA, endomethacin. So prostaglandin E1 and E2 keep the PDA open. Keep is the E1 and E2 is the mnemonic. Next, the fetal postnatal derivatives. So the fetal structure is ductus arteriosus. Its postnatal derivative is the ligamentum arteriosus, which is near the left recurrent laryngeal nerve. The ductus venosus, the postnatal derivative of the ductus venosus is ligamentum venosum. Foramen ovale, the postnatal derivative is fossa ovalis. Allantois or the urachus, it is the median umbilical ligament. So urachus is a part of the allantois between the bladder and the umbilicus. So umbilical arteries, the derivative is medial umbilical arteries. Umbilical, so medial. Umbilical vein, ligamentum teres hepatis or the round ligament. It is contained in the falciform ligament. So that is the end of cardiovascular